Despite having cluster headaches, I managed to work full time. I have quite an active job working in the mountains. I still managed to climb mountains, carry on my hobbies, my woodwork, learning instruments. I think everything is still possible. It's just adaptations that you have to make to find time for yourself. You need to still do the things that you want to do. That's really important. Accept, adapt, and continue. That's my motto.
The best thing I've ever done for myself was travel to Italy while experiencing a cluster headache cycle.
I would say I managed to have a family and a normal work, social, and extracurricular life, as in I play golf, which I seem to be able to do without CH interfering. But mostly focused on the family and having a full-time job.
I'm actually really lucky when it comes to friends and family and support. They've all been brilliant. I've made some amazing friends through meeting fellow clusterhead sufferers actually, and I get great support from that. I think the key thing for people to take away is that we often hide a lot of the pain. We're quite often suffering when we're not in attack, and that's quite often hidden by us just to carry on, trying to act as normal as possible.
I'd like to see my family support me by sharing awareness campaigns, speaking openly about the experience, what it's like living with someone who suffers from cluster headaches.
My family is, I would say, quite well trained, not just for CH in general, but they know to leave me alone when I'm in an attack. Even my 4-year-old son knows that now, after having to tell him a few times to do it. And that's about it. That's really, from my point of view, all they can do. He occasionally will get me like a Red Bull from the fridge or something, or my wife makes sure that there's injections in her handbag when we go somewhere. It's the little things that help make your life easier.
I've been very lucky on this count. My doctor is really good. I've got a brilliant GP and an amazing neurologist in Glasgow now. I think a lot of people still seem to be struggling to get basic medication from their GP, and that needs to change, and needs to change soon. Oxygen needs to be given out easily for people. It's such a chore across the country, all different counties and regions having different rules for getting oxygen. It's a simple process, and it should be a lot easier for people. That would be my hope, is that that could be unified across the country. I also feel doctors and neurologists need to question more when somebody presents with headache conditions. We need to really probe into it to see what condition it is. There's so many primary headache conditions, some of them quite similar and quite hard to work out. That can be done with a 15-minute consultation. It needs time and repeat visits, which patients need to be getting.
I think the entire medical system internationally could support all cluster headache patients by issuing a lifetime transferable prescription for diagnosed patients, similar to insulin for diabetic patients.
I'm quite fortunate in that I get as much oxygen as I want, and my injections and the Immigrant tablets, I also get as much as I want pretty much. I've got a repeat script that I do online. I'm lucky that I don't need to, well, firstly I work from home, so when I do get an attack I can abort it fairly easily with oxygen. When I do need to inject, it's maybe once a week or twice a week when I'm away from home. Otherwise I can abort at home, so there's not a lot the doctors can do for me. I refuse any preventatives, so I purely treat the symptoms symptomatically. So there isn't really much a doctor can do.